Hi, my name is Caroline Hegarty, founder of Equitopia. I'm here with Dr. Joanna Robson. We've travelled to the beautiful land of Holland to meet up with Dr. Karin Leibbrandt, who will be showing us her training techniques to facilitate balanced movement and posture of horses.
We will also be investigating how abnormal and compensatory postures in training can affect the physiology and anatomy of the horse.
One of the main goals of training a horse, whether it's dressage or show jumping or eventing, is to teach the horse how to balance herself, to balance her body, to have a good core stability. A good balance and a good core stability give a very good movement pattern. And we want to teach the horse that in a way that she can keep it herself.
In order to achieve core stability, Dr. Leibbrandt first focuses on bringing a horse into both vertical and horizontal balance. But before we discuss training techniques, we're going to examine the physiological effects of long-term imbalance.
The vertical balance is one of the first things I teach a young horse, because when they are out of vertical balance, they get tension in their body because they have the feeling that they are falling over. Her core is hanging in the two shoulder blades, and when there is too much weight on the left leg, there is too much of her body going to the left side. And what that happens, this happens in her back, so her back is crooked. And when her back is crooked, that gives a lot of tension, and then she doesn't want to go forward, downward, outward with her head. When a horse is horizontally out of balance, that means there is too much weight on the front legs and the hind legs are carrying too less weight. And what happens then is that the horse is making short strides. That means the front leg doesn't go that way but is just going like this. And the time that the front leg is under the body is longer than the time it is in front of the body. So the front leg is landing before it is correctly extended. And that means if the leg is correctly extended, it lands like it should be. But when the horse is like this, it lands on the toe. And then it lands on the back part of the hoof. And then the horse is shifting his weight. The front legs carry too much weight. The angle of the leg is incorrect, so you have more pressure on the tendons, but also more load for a longer period of time. So because there's too much weight, they have to put the front legs down on the ground as quickly as possible. And because they land so hard and the leg is extended, you don't have any shock absorption anymore. Besides the problems here, you can also get problems in the navicular area. So what happens then is that they can get injuries, chronic injuries, because there's overload of the tendons for a long period of time. If he has too much weight on the front legs, the back is hollow. When the horse has a hollow back, the underline of the horse is too long, so you have a very long belly. Then they also get lots of problems in the back. And when the back is hollow, the pelvis goes like this and the hind legs as well. So when the hind leg is too far behind the body, the SI joint gets overloaded.
So this is the surface of the sacrum that attaches into the lumbar spine, so hence the lumbosacral joint. And then the sacroiliac joints is where the sacrum joins into that ilial wing. Here are the paired sacroiliac joints on a mature horse pelvis. Some of the diseases or pathologies we might see would be an SI tear, so a tearing of the fibrous tissues or the sacroiliac ligaments, which then can result in what we call a hunter's bump. One side or both sides may appear higher on the croup of the horse. We could have potentially a synovitis or an arthritis, just inflammation of that joint. This is a fairly normal structure of the sacrum as it joins into the ilium. But what happens over time with stress and strain on those ligaments and the joint capsules is Mother Nature creates bone spurs. And on this older patient, we can actually see some remodeling or some roughening at that sacral bone, which suggests that this patient has had some stress and strain on the joint capsule that attaches around that bone. And when the high motion joint, which is the lumbosacral joint, between the last lumbar vertebrae and those two sacroiliac joints. When that pelvis is stressed and the horse flattens through the croup and hyperextends, that can cause stress and strain at the LS joint. Anatomically, this would be roughly a normal posture, normal position right here. This is hyperextension. And if I tip towards the camera, you can actually see how that pinches.
And when we look at the spine over here, we see that the horse seems to have some kind of S-curve, but that's not true, because these are just the spinal processes of the vertebrae that we see. But here is the 7th vertebrae of the neck, and from there the bodies of the vertebrae go in one straight line. So here we see the spinal processes and they change direction a little bit. So if the horse makes a hollow back, the processes go like this and we get kissing spines. So we can also get kissing spines over here. So we can find it here and we can find it here. Because when a horse puts his neck up like this, you see that he doesn't like it. The back is really getting hollow. But when I do like this, the back is also pretty hollow. Only when I do this, we get a little bit of flexion of the back. But then we really need the neck to be very long with the nose out. When the horse is too round, then we get too much pressure over here. We can have problems with the 2nd vertebrae because there's too much pressure on the ligament that goes from the skull to the withers. The angle in the vertebrae in the low part of the neck get compressed because there's an angle over here. So if the horse does like this, the angle gives a lot of pressure. So we need the horse to do this. So there's space for the vertebrae over there. If there's not enough space and we get compression, we can get arthrosis in this part of the spine. If the horse is in LDR position, that this part gets too tight. And we also see here the saliva glands. When the jaw is going this way, the glands are stressed and they can pop out a little bit. And we can even see concussions and bleedings in the saliva glands when horses are trained LDR. Another problem is if you want to train your horse LDR, you have to pull. And what happens then is you pull with the bit on the lower jaw. So the lower jaw gets blocked. And when a horse wants to relax, the jaw needs to go down for almost a centimeter. It has to move in this direction. But if we pull on the bit, the jaw is stuck and it cannot go downwards anymore. So a horse with too much pressure on the reins is not able to relax his jaw.
This is the temporomandibular joint on the horse. Obviously there's two paired TMJs. And the temporomandibular joint has two motions. One is what we call lateral excursion, so that the horse can grind its food. And then also a flexion extension, or an opening of that joint so that they can graze and grab their hay and grab their grass. So tension in the soft tissue structures, the muscles, the ligaments around this joint, the temporomandibular joint, will prevent the horse from being able to slide so that it has difficulty grinding its food, or the ridden horse is going to have difficulty with softening its jaw, which then also affects the tongue, the hyoid muscles, and everything that attaches into the back of the skull, and the muscles that attach around the jaw and around then that TMJ joint.
The problem with that is that the jaw is the first part of the spine. So if we block one part in the spine, we block the whole spine. And when we block the spine over here, we block the hind leg. And when the hind leg cannot go forward anymore, we always have a long underline and a short top line, and a top line that stays hollow. So one of the problems we see when a horse is trained LDR, he has a good look at the floor, but he cannot see his surroundings anymore. And that's pretty scary for a horse, because a horse has eyes at the side, the left side and the right side, so he can almost see 360 degrees. So if you make them look to the ground, they cannot see their environment anymore. On my right side, there's Apple. Apple is a 12-year-old mare. Before I started training her, she was trained LDR, which means that she is too round, too deep, with the nose back behind the vertical, back to the chest. She's been trained like that for maybe 7 years. Due to an incorrect body posture, you can still see things in her body that are not correct.
I see a little bit of a dip in front of the withers. The sternum is in an area of a lot of tension. And I think when the horse starts walking to me, the toe will come in. Because there's still a lot of tension in the thoracic sling.
The horse's shoulder blade or scapula is only attached by soft tissues, the sling muscles such as the serratus ventralis. We have the pectorals down below that attach to the sternum, and the ascending pectorals, which also attach up to the humerus, which is the upper arm bone of the horse. So it is possible that these muscles will affect your forelimb conformation and posture.
Most veterinarians or owners or body workers think that it's constitution and that you cannot do anything about it. But for the horse it's a problem, because most horses are born straight. And during maybe the first 3 years they can already start developing changes in the stance of the feet and the hoofs.
When these thoracic sling muscles are strong and properly conditioned, as well as the horse's core and back muscles, the horse is in a state of elevation and carriage. The withers are lifted, the sternum is elevated, the rib cage comes out, and the shoulders come out. If that patient has a rehabilitation or an injury, or is ridden hollow incorrectly, had a neck high and the back hyperextended, it is possible then, because these shoulders are only attached through those soft tissues, that those soft tissues begin to drop, and the horse's center or core will actually begin to drop between those shoulder blades. The entire thoracic sling becomes weak, the shoulder blades will rotate, the elbows may rotate, and we can see those postural changes such as toeing in and toeing out.
These are actually the front feet of the horse, the shoulders and the elbow. The toe comes in, elbow comes out, shoulder comes in. You start to walk like this. Better would be this. As a body worker, I can loosen up all the tension around here. Then the horse can start to breathe again, because his shoulders come down and the withers come up.
By working with horses a lot and do a lot of body work, we found that if you release the low cervical and the first thoracal parts, the balance of the legs get normal again, and then you have to change the feet as well.
So it's all together, the feet, the way of riding, the way of breathing, the way of thinking. You have to tell all that to the owner. He has to think in a different way. Let the horse breathe again. Let the horse be happy again.
So first we improve the vertical balance of the horse, and the vertical balance is yes or no. When you're out of balance in the vertical plane and we put you straight, and you are in balance. It's not almost in balance, it's yes or no. So what I prefer to do is, when a horse is carrying more weight on his left front leg, and there's a lot of weight in my left rein, I just ask the right rein and release the left rein in order to get equal pressure on both reins. So what we can see in this horse is that there's a little bit of difference in the tension of the inside rein and the outside rein. The inside rein has a little bit more pressure, and that means that the horse is too much weight on the left front leg. So she's pushing her weight with the right hind leg to the left front leg. So I'm going to ask Maxime whether she can release the left rein a little bit and have a bit more contact on the right rein, just to make the pressure on the reins more equal. So when I do that and the horse gives me contact, because it should be the horse that's making contact with me and not me taking contact with the horse, because if I take contact, I'm always pulling back and working backwards and always shortening the neck. So it should be the horse that's making connection with me. So then I have the vertical balance, I give the release, and they go forwards, downward and out. It's almost a little exercise, it's shoulder out. But it's not shoulder out to get the shoulders out, but to get the hind legs away from the fence. So what happens when Maxime takes more contact on the outside rein is that the horse is bending to the outside. The hindquarters go from the fence more to the inside, and the hindquarters get straight behind the front legs. And as soon as we feel that her weight is from the inside front leg to the outside front leg, and her hindquarters are from the outside straight behind the front legs, we release the horse, and she wants to take more pressure on the outside rein because she's in vertical balance right now. Yeah, very good. And now you release. And when we do that, at first the horse is bending with her neck too much to the outside, but when she does so, she will get her weight from her inside front leg to her outside front leg, until the weight on both front legs is equal. And as soon as that happens, the horse will choose herself to go into FDO, forward, downward and out position. Because when her weight is equally divided over the two front legs, she can relax her back. So when Maxime releases the horse completely, when she is in a good vertical position and in a good enough horizontal position, the horse will remain in the same rhythm, and she will keep on having the same strides, like this. Very good. When we have the vertical balance, we want to go on with the horizontal balance. And the horizontal balance is a little bit more difficult, because the horizontal balance, when it's enough, the horse has enough length in the neck, and when you let go of your rein, so you're not supporting the horse anymore, she's not going faster. When the strides are getting faster and shorter, when you let go of the horse, then you know, oh, the horizontal balance of this horse was not good enough. But if you release her and she's on her own 4 feet, still has the same strides, long and regular and smooth, then she was in horizontal balance. Lower your left hand and steer and let go. So yes, this is beautiful. But in time we want to improve it. We want more weight to the hind legs. But first we need the vertical balance and the horizontal balance with a lot of length in the neck, so the back can flex. And when the back is flexed, we can start to shift the weight to the hind legs. What we're going to show now is the weight shift of the horse. And we'll do it in a horse that is standing, so that's a little bit strange, but we're just going to try it. So what we first need is the length of the neck. And what most people think is that if we give length of the neck, that the back goes up. And that's true, but it's not a lot. As you can see, Maxime is not really going up. But when I ask the horse to make a wither lift, you can really see the difference. So just getting the head and the neck in the right posture is not enough. We have to train the horse to lift the withers. So how can we do that? First, we have to make the horse aware that it is possible to shift some weight to the hind legs without moving. So we have to combine that all together, that she can shift her weight to her hind legs, that she needs enough length in the neck, and that she has to lift the withers. So how does a horse lift the withers? By closing the underline. That means that the front leg and the hind leg have got to come closer together. And one of the things we can do is ride a circle. And the first thing we want is that the horse keeps her weight equally over both front legs. So we're not asking her to bend her in the neck, we're going to ask her to bend in the core. Because if she bends in the neck, she doesn't have lateral flexion, she's just bending in the neck. As soon as this horse turns the front legs, we will release the outside rein, because when the horse is with the front legs and the hind legs on the line of the circle, she has lateral flexion in the core. If we make the circle smaller, she has to do more lateral flexion and more closing the underline of her body. And when she closes the underline of her body, she has more flexion of the back. And when she has more flexion of the back, she can put more weight from the front legs to the hind legs. So now the horse is changing her posture of her head and her neck, not because we asked her to do so, but because she changed her horizontal balance. She made more lateral flexion and she closed the underline of her body. Release her, but push her away from you with your body. Yes, that's good. Yes, and give. This is good. I want the nose a little bit more out, and that is on your left rein. Very good, very good. Very good. The horse gets stable and he wants to go into forward, downward and out position. What we're going to do now is to ask the horse, by a little bit pulling back, to change the position and get the nose a little bit behind the vertical. And what we already see is that the horse is getting crooked. She's falling on the left shoulder again, and she's having a lot of resistance. She has a lot of tension now in the muscles. She's moving her mouth a lot. Her ears are a little bit stressed, her eyes are stressed, and what she's doing now is a lot of extension in the back. So what most people think is that if you put the head of the horse down, the back will come up and the back will flex, but that's not true. Only if there is enough length in the neck, the back will flex. The other way around, if the neck is too short, you always have extension in the back, and the pelvis has extension and the hind legs will go behind the body instead of underneath the body. But we still see that the strides are very short. So instead of making long strides with the front legs, she makes very short strides. And if you make very short strides with your front legs, you also make short strides with your hind legs. It's not possible to do it in another way. So when you make the neck short, you have short strides and the hind legs cannot come under the body. And now give her length in the neck. Yeah, let her go. More. And we immediately see the change in the movement pattern. And we see the change in her face. This is very good, Maxime. Give her a complete stretch. Very good. We still have a horse that's in balance, not in balance, in balance, not in balance. But the longer we train her today and in the future, she will keep her balance herself.